Hi, my name's Leana Detweiler, and I did my presentation on strokes. So what is a stroke? A stroke occurs as a result of a blocked blood vessel or bleeding in the brain. There are three different types. There's ischemic, hemorrhagic, and transient ischemic attacks. So an ischemic stroke is caused by an obstruction or clot in the blood vessel supplying blood to the brain. It's the most common type of stroke, accounting for about 87% of all strokes. A hemorrhagic stroke occurs when a weakened blood vessel ruptures and spills blood into the brain tissue. There's two different types of weakened blood vessels that will cause a hemorrhagic stroke. The first being an aneurysm, which is a ballooning of a weakened region of a blood vessel, and if left untreated, it will continue to weaken until it ruptures and it'll bleed into the brain. Arteriovenous malformation is another one. It is a group of abnormally formed blood vessels, and a rupture of just one of these blood vessels will lead to bleeding in the brain. Hemorrhagic strokes are most commonly caused by uncontrolled hypertension. And then lastly, a transient ischemic attack is often referred to as a mini stroke. It occurs when an artery supplying oxygen-rich blood to the brain becomes blocked. Most often, temporary clots are the cause of these blockages. So every stroke is unique, however, they all tend to have the same effects on people. It just depends on the location of the obstruction and how much brain tissue is actually affected. So, for example, if a stroke occurs in the brainstem, depending on the severity, it can cause both sides of the body to be affected, and it may put someone in a locked-in state when the patient is unable to speak or produce any movement below their neck. A left brain stroke will affect the right side of the body, and it could produce any of the following: paralysis on the right side of the body, speech and language problems, slow, cautious behavioral